What is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. Blood glucose, also known as blood sugar, is our main source of energy and it comes from the food that we eat. Most of the food we eat breaks down into sugar and released into our bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into our body cells to use as energy. With diabetes, your body doesn't make enough insulin or can't use it well. Glucose then stays in the blood and doesn't reach your cells. Having too much glucose in your blood can cause health problems like heart and kidney disease. It also affects the eyes and feet. There are two types of diabetes, simply called as type 1 and type 2. There are also rare types of diabetes, but they all have something in common. They all cause people to have too much glucose in their blood.
Reasons why people develop diabetes is because it runs in their family. The immune system is the cause of type 1 diabetes. The pancreas, insulin-producing beta cells, are attacked and destroyed by the body's immune system as a result of the infection. Environmental factors, such as a virus, may also play a role in the disease onset, while type 2 diabetes is caused by a person's lifestyle, such as being overweight or obese. Scientists believe that hormonal changes during pregnancy, as well as hereditary and lifestyle factors, cause gestational diabetes, a kind of diabetes that develops during pregnancy when women who are overweight or obese become pregnant. They may already have insulin resistance. It's also possible that gaining too much weight during pregnancy is a rule. Mutations or alterations in single gene produce monogenic diabetes. These changes are usually passed down through families, but sometimes the gene mutation happens on its own.
When diagnosed with diabetes, and if not treated early, it can cause several problems to our body systems. One of the most known effects of diabetes is the damage to our circulatory system. Due to excess blood sugar, the blood vessels decreases their elasticity and becomes narrow that can slow down the blood flow of the body. When the blood flow slows down, this can reduce the supply of oxygen and blood to the body, and thus increasing the risk of having a high blood pressure. This can also lead to heart attack and stroke. Poor circulation can also affect the ability of your body to heal when you have wounds or infection. Nerve damage is also a common complication that is caused by diabetes. It can cause numbness to pain that makes it harder to do your daily routine or activities. It can also cause severe stomach pain, nausea, urinary problems, and infections to the body, especially food infections.
Effects of diabetes on human behavior. Patients with diabetes frequently suffer shifts in their mood and behavior. These changes occur in both type 1 and type 2 diabetic patients. The following things may have an impact on a diabetic's mood and behavior. Number 1 is feeling sad or depressed. Second is feeling irritated. Third, a constant feeling of tiredness and lethargy. Next is being angry or easily agitated. And lastly, feeling restless. Why do these changes occur? Number 1 is blood sugar levels fluctuate. Changes in blood sugar levels are closely linked to behavioral changes. Number 2 is diabetes-related stress might be on the rise. It's common to become frustrated or anxious after being diagnosed with it. Number 3, it's not uncommon for a diabetic to get depressed. Diabetes is a difficult disease to manage. It might be sad to eat a handful of pills every day or inject oneself with insulin.